I'm Kristen and I'm going to be doing the abdominal assessment today. So I'll start by asking for family history, health history, and go from there. I'll start with having the patient pull their shirt up, and I'm going to start by inspecting the abdomen for the color, any abnormalities, skin abnormalities, contour, make sure that the breathing is symmetric and that the respirations are even and unlabored. I'm then going to auscultate. And I'm going to go in a clockwise direction. I'll warm the stethoscope and I'll start in the right lower quadrant, and I will listen for the bowel sounds. It should be around you should hear about 30 to 50 gurgles. And I'm going to go to the right upper quadrant, then the left upper quadrant, and the left lower. And if you don't hear any bowel sounds, you want to listen for at least 5 minutes until you hear something, or you can then document that no bowel sounds were noted. You can describe them as active, hypoactive, and hyperactive. Then we will use the bell of the stethoscope, and same thing, right lower, right upper, left lower. And with the bell, you will listen for vascular abnormalities, any bruits, friction rubs, and that's it with the auscultation. Next, we'll move with percussion. So we're going to then have the patient sit up, and you will percuss for the kidneys on the back. It'll be the lower back area, mid-lower back, and you'll place your, let's see if I can do it, non-dominant hand palm flat, and you'll put your dominant hand in a fist and just give a little hit. And you'll be percussing for any dullness or tympany, and you'll do the right side and the left side. You'll then have the patient lay back on their back, and you'll percuss the stomach. We can start with percussing the liver on the right upper side, and again you'll be percussing for tympany and dullness, and again you'll use your palm flat and you'll just hit with the fist on top of your hand. And then on the left side you'll be percussing for the spleen, and you can start from the left side and just give a little bump. And again for the tympany and dullness. You can then move to the bladder right above the symphysis pubis, and you will percuss, and here you can do just with your finger and tap the middle finger and go from the symphysis pubis and go up to the umbilicus. And also, again, you can percuss from the right lower abdomen all around to the left upper, left lower, and you'll be noting for the organs, any dullness and tenderness. So then after percussion is palpation. With palpation, you are going to be, there's light and there's deep palpation. For light palpation, again, clockwise, you will start in the right and go to the left. So light palpation is about 1 to 2 centimeters deep, and you'll be noting any tenderness or guarding. Also noting any distension in the stomach. After the light palpation, you will move to deep palpation. Deep palpation is about 4 to 6 centimeters deep, and once again, clockwise, starting with the right lower, right upper, and this is where you will palpate the organs for any tenderness or any abdominal masses, and this is where you will note that. And that concludes the abdominal assessment.